Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you all from the Adolph Simons Family Studio, and delighted to be back with you on this beautiful Monday morning. Summer has arrived in Kansas City, and boy, does it feel great. We have a special update this morning. In just a moment, we're going to watch as longtime blood donor Grant Barnes gives again. Grant, thank you. We'll hear from Katie Pino, who needed a life-saving blood donation during childbirth, and learn from Chelsea Smith from the Community Blood Center if they are still in a blood emergency. Newsflash, they are. They need some help. We're going to talk about that. It's also National Blood Donor Awareness Day, and we have much to share. But first, Hawkeye, let's share the numbers.
Yeah, we talked about just before the show started, numbers creeping up a little bit.
They're creeping up.
That's what I thought.
That's what Siri thinks so too.
Hopefully, I think we're going to keep watching the hospital numbers as it is. We know that in the nation that the cases have increased a little bit as well compared to where they have. So we plateaued, maybe a slight increase as well. Here at the hospital, we have 11 active infections with 2 in the ICU and both of those on the ventilator. We still have 5 additional cases as well. So a total of 16, kind of creeping up slowly. We just got to continue to watch the trends.
There is a little bit of a COVID creep. I'm not sure I like it. Great Britain delayed their opening now, or it looks like they're going to delay their opening because of the Delta variant. We know the Delta variant is in the United States. It hasn't taken off like the Great Britain variant so far.
Not yet. And I think those keywords are so far. We know that I think a week or two ago it was 6%. Latest information I saw from the Washington Post is that it's up to 10% now. But the good thing about that is vaccinated people are still protected from that.
I think that is the most important deal between vaccination and people who may have had COVID. We may have a pretty high percentage of the U.S. population now that has had at least one vaccination or had COVID. So that's good news as we continue to push those numbers up. Other good news over the weekend, Novavax. Looks like they're going to have announced their trial results early this morning. Outstanding results. It's right up there with Pfizer and Moderna.
Yeah, I think you're exactly right about that. Again, really very efficacious at protecting against severe disease and death, 90% or more. We are happy about this because it's one more piece of prevention we can use if people have concerns about the J&J vaccine or the mRNA vaccines. This is a different vaccine and just one more thing we can use because we know how much protection the vaccines offer.
Maybe you can just spend a quick moment explaining a little bit about it because it's a protein vaccine. It's a little different than the other vaccines out there. I don't think it requires specialized refrigeration either.
Yeah, storage is really good. This is a vaccine that is the information is put into a different virus. The virus then infects moth cells, actually cells that are grown from moths, in huge bioreactors. And what they do then is just purify those spike proteins. Those spike proteins then coalesce to form a nanoparticle, and they are given with another molecule to help rev up the immune system to create that. So it's not mRNA. It's not a vectored, a virus vector like the Johnson & Johnson vaccine. It is just the piece of the spike, and that gets injected into you along with the adjuvant that helps rev up that immune system. It's just a separate molecule. And again, they also saw that maybe the side effects were a little bit less than some of the other vaccines as well. So a lot of options now, hopefully, for people.
Interesting. Fewer side effects from the vaccination itself. It looks like it's very safe.
Very safe.
And I think it can be altered if needed be, but it's against a spike protein. So that's really good news because the spike protein's part we know is pretty consistent. So this could be especially an important tool around the world. There's some discussion about whether or not it will get an EUA in the United States because we have unused vaccine today. And we have, they're all very efficacious. So Novavax is probably really important. It may be more important to the world than it is to the United States. So that'll be an interesting development, something that we really want to keep track on throughout the pandemic. So let's turn now. I understand there's no reporters on the line.
Well, I do have a question from Donna Pittman.
Go for it.
And you sort of spoke to them, but she wants to clarify a little bit more. You said that we should not be fearful of the Delta variant if we've had our vaccine, but how safe are we and how do you know?
So I think, Huck, let's explore that question a little bit.
Yeah.
It looks like the most of the vaccinations are effective against the Delta variant, which is the one coming out of India, at least in preliminary data.
Yeah, and we're getting a lot of this real-world data right now from the UK. And just as you mentioned at the top of the show about they're maybe holding back and continuing those restrictions because of the Delta variant. So a lot of the real-world information we're getting from that. And what they are seeing is that although the Delta variant is spreading there, especially for those vaccinated people, they aren't seeing the increase in deaths. So that is very good news on that front as far as real-world data.
One other thing to make note, there was an article that appeared in the New England Journal of Medicine late last week looking at sustained autogenicity as a result of the Moderna vaccination, suggesting that you maintain very high antibody levels for at least 6 months and still there. So any thoughts about that?
Yeah, I think that's good. We do understand that no matter what, whether it's vaccination or natural infection, we know that antibody levels start to wane, so that shouldn't be a concern to anybody. You still have the memory B cells that can create the antibodies and get recruited very quickly if you do get exposed to that virus. And we still know you still have the memory T cells as well. So overall, things are looking good. We continue to have positive information from the vaccines.
Yeah, good stuff out there.
And then her follow-up question is, on the Novavax, what percentage effectiveness is it? And is it its own third type of vaccine, or is it similar to the J&J?
It's really different than the J&J vaccine, actually, because J&J uses a neutralized virus, essentially, to cause your immunogenicity. This is using the virus to help produce the spike protein, which then you get. So it's really a third kind of vaccine.
Yeah, absolutely. The mRNA vaccines, we know that when you get injected with those, your body uses that mRNA and creates spike proteins. You then create an immune response to that. We know that with the J&J vaccine, your body also creates a spike protein due to the DNA in that. This one is actually the spike protein itself that's already been grown up in these labs, in these bioreactors with these cells that are already creating the spike protein. So at this point, you are just really getting an injection of the spike protein itself.
And just to say, I don't know of a lot of prior history for the use of the protein-based, like there's a protein-based vaccination. Are you aware of it?
Yeah, there are other protein-based vaccinations which are very helpful. Hepatitis B is one of those. Just little pieces of the virus or little pieces of the bacteria. So again, not new technology per se, not a new type of vaccine per se. We have those and have been using them for decades.
But a different type as far as SARS-CoV-2.
Yes.
So, yeah, good. So then the other question, just to say to our audience, now Novavax has been in the news a little bit because they had some trouble ramping up production. I think they went to other companies to help them ramp up production. But that's not an uncommon thing in the drug industry, is when you are a small or startup company and you have a new drug or new therapy, you often turn to other companies to help you produce them.
Yeah, that, and also remember when they were still getting their trials underway, suddenly we had the availability of mRNA vaccines to give because they had already been authorized. So that helped delay some of the trials as well.
Yeah.
All right, I think we're good.
All right. On Friday, the Community Blood Center of Kansas City was heading into the weekend with a severe shortage. Chelsea Smith, outreach coordinator at the CBC, well, that sounds kind of cool to say it like that, CBC, joins us now with an update. So how did you guys do over the weekend? Did you gain any ground with donations? Where are we, Chelsea? And welcome back to the program.
Thank you for having me. I'll run through those numbers real quick, but first, let's get Grant started on his donation real quick. Over the weekend, we did see a small bump in our O's, which was huge for us. So on Friday, if you remember, I mentioned we had a 1-day supply of O-neg and O-pos, and I'm happy to say that we have a 3-day supply after the weekend that we just had, which is great. We're still not quite there. We need to get back to that 7-day supply of blood across the board of all blood products. But so still a blood shortage, but we are moving in the right direction, and we're hoping that we're going to keep that momentum throughout the week.
Yes, indeed. And tell Grant a big thank you from all of us. And I think he's rocking that Can't See Royals hat. Maybe he can do a few at-bats for us and see if we can score a few runs or maybe even pitch a little bit. Probably not with his right arm right at the moment, though. All right, so...
Probably not right now.
Yeah, probably not. Is this a time of year that is historically a tough time for donation, Chelsea?
Yeah, absolutely. We always see lower donations in the summer months because people are busy. They want to be outside more often. They're on vacation. But simultaneously, we also see a spike in usage in the summer months, as I'm sure that you guys are well aware. Emergencies, they go up. Traumas go up in the summertime. So people use more blood. And unfortunately, when you pair that with our low donations, it's a perfect storm, creates a blood shortage every summer. And then on top of that, we're still dealing with the repercussions of the COVID-19 pandemic. So it's a little dire.
Do you think that people are still concerned about COVID-19 and so they haven't come back to the blood to donate blood? Number one. Number two, are you able to do the same type of mobile blood drives you've done in the past?
Yeah, number one, we do think there's a population of people who probably still do have those concerns about maybe contracting COVID if they come in and donate. We have stats, we have numbers that show that there's about 25,000 donors who are regularly donating pre-pandemic who have not been back since. So it could be for a number of reasons, but we do think safety is probably a big one. And to those donors, I would say that we are continuing to mask up, we're continuing to socially distance, enhance disinfecting protocols across all of our locations. So we are doing our due diligence to make sure that these are safe and controlled environments for donors to come in and donate. That being said, we still don't have quite the number of blood drives out in our communities that we had pre-pandemic. We are getting back up there. We're able to go out. We have hundreds of blood drives every month, but we're still a little bit lower than what we were seeing pre-pandemic. So we're hoping that in the coming months, those blood drive numbers will increase as well.
Yeah, that's just so important. I mean, as a ICU physician here at KU, or former ICU physician, I can't tell you how important blood transfusion is when you have, and blood product, whether it's platelets or other things, it's just so important. And without donors, man, that can't happen. So let's turn to Grant for just a minute. Mm-hmm. And Grant, how many times have you rolled up your sleeve and given blood?
This is my, I think, 20th time I've donated now.
That's awesome. Tell us why you do that. Why is it you're such a consistent donor?
Yeah. So my grandpa was the universal donor. He's O negative, and he had donated for something like 12 gallons of blood in his life, and just a ridiculous amount of times, like hundreds of donations. I'm not even sure how many it was. And just at a young age, my mom and my grandpa had put into us like how that was an important thing to do. And so I started donating long before I even worked here at Community Blood Center.
So is this a requirement to work at Community Blood Center that you have to give a lot of blood, or is that those things really disconnected and you're just doing a lot of hero work there?
I mean, I do love working for Community Blood Center without a doubt. But I believe in what we do. Like it's our motto that we help save lives, and so like I believe in that, and I think donating is just a part of that. And so, yeah, I'm just a true believer.
Yeah, I'm with you. That is awesome. Did you donate blood throughout the last year?
Yeah, I did. Yes, and that was, I mean, as you know, there was a couple times we went into some shortages, and so they called out the employees like, hey, we need you. And so that was stepped up for that.
All right. And do you get to wear that Royals hat every day at work at the Community Blood Center?
No. So I actually work down in the lab for the most of the time. And so they don't let us wear what we want, like Royals hats and whatnot. Yeah. I'm pretty much in the lab coat all the time.
Okay. So do you feel safe while donating?
Absolutely. I started as a phlebotomist, and so I feel 100% safe donating blood just because I know what it's a safe process to do it. And we go around and start with people that are high schoolers, and so as adults, there's no threat.
Yeah, that's amazing. And so to encapsulate this between Chelsea and you with Grant, what an important thing to be doing all the time for patients all over our community. We want to say thank you for the great work that the Community Blood Center does. And I know, Hawkeye, we depend so much on the Community Blood Bank. to get blood for all of our critically ill patients. I wanted to bring Katie in now. Katie, you're a patient who needed blood, right? I mean, you were one of those people who were critically ill and had to require that, and benefited from the generosity of people like from people like Grant. So tell us a little bit about what happened. Why did you need it, and how did it feel to have blood donated to you?
Yeah, I was delivering my second baby, and I suffered a laceration in childbirth that just escalated and escalated to the point where I needed blood transfusions. And I'm so thankful that that blood was available to me. They said O positive was one of the blood types in shortage. That's my blood type. So I'm so thankful that they had some there, and it was a quick solution to an otherwise devastating outcome if we didn't have blood. So thank God.
How many units of blood did you require? Do you remember?
So I had 3 units of blood and then 2 coagulants. So it was 5 blood parts total. I'm not completely sure what all that means, but I know it's more than one donor that donated.
They were giving you, I think, fresh frozen plasma, because that'll help your blood, help you stop bleeding, and then the blood to help replace the blood you've lost. So did you ever worry about having to receive blood while you're in the midst of a pandemic? Did that scare you at all?
No, because I would much rather have that than the alternative, which is dying. So I happily took the blood, and I have honestly never donated blood before. So it's been really eye-opening to me, number one, for having it there. I've never really thought about it, never realized about what a crisis it would be if it wasn't available. And number two, the amount of family and friends that have come forward and told me that they are alive today because of transfusions. So I'm very thankful that people gave blood even in a pandemic, and I don't know what I would have done without it. So obviously I wouldn't.
Well, and you have a beautiful family. We're seeing the photos of that. So you've just described about how you feel about donating blood. Does it make you feel like you want to go out and give blood yourself?
Oh, absolutely. As soon as I'm cleared, I definitely will be donating blood. I'm thinking of doing something on Victoria's first birthday with our family to try and help donate blood and promote the cause. And actually, I've had a coworker who was out at work one day and saw a blood drive, and she donated on my behalf as well. So I'm definitely going to forever do my part on helping with the blood shortage that there is, and help promote donating blood and donating blood myself.
Yeah, that's a beautiful story with a good ending and a great commitment. And I think, I know, Grant, we so appreciate the fact that you both work at the CBC and are a blood donor. I know Katie appreciates people who are donating blood, and Chelsea for all the great work that you've been doing and all the great messages Chelsea's helped us bring throughout this pandemic about the importance of donating blood to help those who are critically ill. There's nothing that replaces blood when your patients are really sick. And I know, Hawkeye, you've seen us running around like crazy in the ICU waiting on the blood to arrive with somebody who's bleeding, because we know it's just, we only have a few moments of time before things can go really south there.
Yeah, absolutely important. Even like I said last week, as walking through the emergency department, saw a trauma come in. And so it's definitely needed now. We know this is high time, not only because of increasing procedures, where you need blood if you have blood loss, but also people are traveling, a lot more trauma during these summer months as well. And
we sometimes have patients who may need 20 or 30 units of blood products at some point or another, and that, that's really critically ill. And man, that this takes a lot of coordination and work with the community blood bank. So, and look, Grant, that went so fast. You're done already. You got your arm in the air, the needle's out there, you're still alive, already. You look good, your Royals hat still looks good. How do you feel?
Kept it on straight. Feel good.
Yeah. All right. So can you, after you've given blood, Grant, can you just kind of go back to life as usual, go down, go to work, do the things you need to do?
Yeah, I work third shift in the lab, so I'm actually, after this, I'm going home and crashing, and then I don't come back to work until later tonight.
Okay. Do people, after they give blood, need to go take a nap, or they can go down and just go about their lives?
Yeah, you can go about your life after donating. It's just got to stay hydrated, and that's the key.
Yep. As I used to give a lot of blood, and as a blood donor, I would sometimes give blood and drink a whole lot of fluid, and I might happen to go for a jog then. I'm not sure if that was the doctor's advice or not, but that's kind of what I did. All right, let's see now if there are questions out there about anything related to blood donation or anything at all related to COVID-19. Obviously, these subjects are somewhat tied together, and we are happy to try and answer those from the community, Jill.
And we have both. I'll start with the blood donation questions. Debbie wants to know, and I'm not sure I quite understand her question, but she is concerned about donating blood when it's just giving it for routine lab work. Is blood ever donated for routine lab work only?
Chelsea, I don't think that's part. I mean, I don't think we give blood for routine lab work unless people are saying it gives them a way to get their blood counts back and have it be free or something. I'm not sure. What do you think?
No, yeah, at the blood center, we don't take blood for routine lab work. That would take place at, a hospital with your primary care doctor, in a lab there. Here we take blood donations that are strictly meant for transfusion for patients in trauma situations, patients struggling with cancer, things like that. So we wouldn't fall into that category.
And Chelsea, just to say, you all screen the blood for certain viruses and things like that, so you know that it's safe. Do patients get a copy of those results?
They do not. We do screen the blood transfusions, or blood products, yes. If there is something that we find in the blood transfusion, if the test comes up positive for something, we do notify those donors immediately. However, usually most of the donations, once they go through the testing process, are cleared, and we send them for delivery to our hospitals. So, if there's something wrong with it, the donors will know immediately.
Okay. Jill.
Cindy wants to know from Katie, did you feel fine after having all the many different blood donations?
Yeah, I mean, I had a baby, so as fine as you could be after having a baby and an emergency surgery, but I felt great. I was back with my baby, holding my baby in a matter of hours, which is really unbelievable when you think about what all happened that day. It was a very eventful day, so it was a very easy recovery for me. Thank God for the hospital and the donors, because it could have been a lot worse. I felt great.
Oh, that is a great picture. Okay, we're seeing the one having wrapped in the red blanket. That's your baby daughter, right? Wrapped in that red blanket. That's pretty cute. Okay.
Debbie wants to know, can you donate blood if you're on blood thinners?
Chelsea, what about the risk of blood donation if you're on Coumadin or other types of blood thinners?
So most medications are not going to defer you for a blood donation, but blood thinners are one of them. So not all of them, but most of the blood thinners you're likely going to be deferred from a blood donation. I would encourage you to call our medical team just to run those specific details by them, though. Our medical team hotline is 800-688-0900. So just let them know what kind of medication you're on, what dosage you're on, and they can give you some information about that. But yeah, blood thinners, more likely than not, you're probably going to not be able to donate blood.
Katie, if I know that I have the same blood type as somebody who's critically ill, can I walk into the blood bank and say, hey, I want to give blood to this person? I said Katie,
Chelsea.
And I meant Chelsea.
Oh, I'm so sorry. Were you
No wonder
talking
everybody
to-
looked at me like I was blank. Yeah, my bad there. Sorry. It's Monday morning, right? Come on.
Yeah. Can you repeat that, Dr. States?
Yeah. So Chelsea, let's try that again. Chelsea, if I know somebody who's really ill and needs blood and I have the same blood type, can I go over to the community blood bank and say, hey, I want to give blood for this person?
So we do have a directed donations program. That needs to be arranged ahead of time, so you can go online and find information about that. Typically, we don't do directed donations, which means that you have a donor that says, I want to give to this specific recipient. Usually that recipient is in need of blood products immediately, and so we give them whatever we have in our inventory at that time. But we do have situations where, for example, if We know that a certain patient is going to need a continual drip of platelets for the next few weeks. We are able to set up some donations that can go directly to that patient. However, that'll go through our special donations program. So we encourage you, if you're interested in doing that, please go online to savealifenow.org and you'll find more information about that.
And Chelsea, how long does it take to give blood?
In general, we say anywhere from 45 minutes to an hour, and that includes from the minute you walk in the door, you get registered, you go through our history process, you get on the bed like Grant, and then when you finish, you're in refreshments, drinking juice, eating cookies. That entire process takes anywhere from 45 minutes to an hour.
Well, juice and cookies is reasons right there to go give blood.
All right, Debbie says that we misunderstood, or I did, her question. She said what she was trying to say was she feels faint after she just gives blood for routine lab work, but she would like to donate blood. Would you recommend again?
That's a different question.
Against it?
Got it. I think a lot of people feel faint around, they get the needle in their arm. People get vagal. We see that not infrequently. But Chelsea, I bet that you guys are prepared for that, and you know that people can kind of get up a little more slowly, get their juice and cookies, and before they have to roll out.
Sure, yeah. We have, so about, in the industry-wide, we usually see about only 2% of our donors have a reaction like that, where they might pass out or not feel well. Typically that doesn't happen. When you come in and you donate blood, we do ask that before you prepare by hydrating well, eating big meals. Actually, before you donate blood, that's a really good time to cheat on your diet. We want you to eat a greasy cheeseburger before you come in, a really big meal. Come in, donate, have lots of water. Right after that, you're drinking juice, eating cookies, like I mentioned. And our staff, if you were to have a reaction, our staff are very well trained to handle that. And it will likely be something that only lasts a matter of minutes, and then you are out the door and ready to go. So I would like to stress that that is not a typical response to blood donation. We usually, donors come in just like Grant here, and they donate a pint of blood and they're completely fine. So be encouraged there.
So Grant, when you've given blood, have you ever gotten a little lightheaded?
No, I don't think I've ever had a reaction, and I, like you, I typically go out of here and I feel like I'm ready for a jog. So again, not necessarily the recommended, but like Chelsea's saying, I think people having a reaction, that's fairly rare.
Yeah, there you go. And it's probably the only medical procedure known to man where we say eat a greasy cheeseburger and fries with a chocolate shake before you come in and do something. Normally we kind of tell you not to eat anything like that. So giving blood, what a win, break your diet, go to Four Guys or whatever the place is.
Dixie and Lindsay want to know about restrictions to giving blood. Dixie wants to know, can you do it if you're a cancer survivor? Lindsay is just interested in knowing, are there age restrictions or blood donation restrictions? Do you take all types, all people?
So let's break that apart. Let's start with age. Are there age restrictions, Chelsea?
Yes. So we can accept blood donations from 16-year-olds with parental permission, and then 17-year-olds and up, you don't need parental permission. So we don't go below 16 per state laws. But if you're a 16-year-old, this is why we go into high schools. A lot of times the very first donation that people ever make are in high school blood drives or college blood drives, which we didn't have any of those this past year. So unfortunately we missed out on a lot of first-time donors. But 16-year-olds, 17-year-olds, 18-year-olds, we want to see you.
And so, Chelsea, what about if you're a cancer patient, either being treatment or you've had a history of cancer? Does that take you out?
That depends on the type of cancer. And actually, in 2020, the FDA released a lot of new regulations, and some of that included lesser restrictions for those who have had cancer, certain types of cancer. If you've been in remission for a certain amount of time, you may be able to donate blood. So that's another question that I would encourage you to call our medical team and give them the specifics of what kind of cancer you had, how long you've been in remission, those details. Again, that number is 800-688-0900.
All right, so Katie, 16 years and over. You got 16 years before one of your children has to donate blood. So I think we're not going to come after them yet. Fair?
We will when they're 16.
Bob says, I have trouble getting out an entire unit of blood in the past. What happens to the blood if the CBC can only get a partial unit?
Yeah, so we do have, per FDA regulation, we do need to collect a certain amount of blood in order for that unit to be considered viable. If you're somebody who clots easily, we do strongly encourage that you hydrate before you come in, because it does help. It helps avoid that clotting process mid-donation. But if you're able to fill the bag up to that certain point, that makes the unit viable, maybe you didn't fill it quite all the way, but you're able to get it to that point, we can still use it.
Peg donated blood on Friday, and she was asked to give the travel locations of where she'd been in the last 3 years, and she's wondering why.
Yeah, so this predates COVID. We have to ask for your travel information, because certain countries that may have high malarial rates or things like that, we have to take note of that and be aware of that when donors come in. So if you've traveled out of the country in the last 3 years, it depends on where you were at. We're going to have to ask you for those details, and you may be deferred if you've traveled to a country that has a high malarial rate or things like that.
Okay, 2 more blood questions, and then we have some COVID questions for the doctors to answer. Linda says, the group of us veterans that served overseas during 1979 to 1981 have been told we can't donate because of exposures we had. But during the pandemic, it was changed and we could. Can we still donate it, or is it back to we can't? Well, we're still in the pandemic.
We're still in the pandemic. So, Chelsea, let's take that on and tell us a little bit about why those restrictions were out there for people who served between 79 and 81.
Yeah, so that specific restriction refers to, I'm going to botch this, Dr. Stites. It's Creutzfeldt-Jakob's disease.
Yeah, you did that very well.
For the lay people like us is mad cow. Did
mad
I?
cow disease.
Good.
You did good.
Yeah, so that refers. Good. That refers to the mad cow outbreak that was happening in European countries at that time. The restrictions for that changed during 2020, those were restrictions that were under review by the FDA for a long time. So it isn't that we were in a pandemic.
Oh, we lost her. It wasn't that we were in a pandemic. I'm pretty sure Chelsea was going to finish by saying that those restrictions would have been lifted anyway, because that had been something that had been studied by the Food and Drug Administration all along the way.
Okay.
So,
And
do we have any questions for Katie, I wonder?
Not
at this moment, okay.
Yeah, and I think you can answer this next one until we can, and unless we can get Chelsea back.
We can go talk COVID.
Debbie wants to know, when you say there is a need for blood, is that all blood types, and how do you know your blood type?
Yeah, the blood type you find out when you go to the community blood bank, and they can do that. I wouldn't get too hung up on the type of blood. And the reason I would say that is sometimes there are some types of blood where in an extreme emergency you can give to any blood type, O being one of those. And so that's kind of the ubiquitous, if you will, blood type. So I think that we'll take the community blood bank will take, and we'll take any kind of blood, and I wouldn't worry about the type of blood you have in order to give. I think that's the safest way to look at it.
Okay. Lindsay and Judy are concerned about the numbers creeping up at KU, and they want to know if you could tell us, of those patients, how many have been vaccinated, and they would like to have that information every day.
Yeah, we can today. I don't know about today, but we'll come back with this question tomorrow. We'll talk with Amanda to give it to us. But I think that the folks who are critically ill had not been vaccinated.
Yeah, patient I'm seeing that mid-50s, no other health problems, lives in a rural community, unvaccinated. This could have been 100% preventable. This is a patient that's on the ventilator, is on the ECMO, where we're using something like a kidney machine to help do the gas exchange through your lungs. So, we can get that information, and we have been presenting it on a weekly basis, but certainly we can present it. But that patient was unfortunately unvaccinated, and this was 100% preventable.
Yeah, and I think that's the important point. It is 100% preventable because the vaccines do prevent critical illness and death, and so. Gosh, it's just so important to get vaccinated. And just to say, I think that the experience that we're seeing that is the unvaccinated patients who are getting critically ill is not unique to KU. There's data that can come out about that was out last week showing that same effect throughout the United States.
Yeah. Yeah, absolutely. We know that the way to protect us individually and as a community is continue to get vaccinated because of that reason. Even against the variants, the vaccines are extremely effective.
Kathy has a friend who thinks that 4,000 people have died from taking the vaccine. She says she can't believe he knows the information, that he believes it's not being reported. What do you say to her that she might be able to say to him that would help him better understand?
Wow, man, because I say this is one of those things where people are going to believe what they want to believe, and it's hard to dissuade them, even when you have the facts and they don't. And there is no conspiracy, folks. I know people are, oh, there's a conspiracy. This is a worldwide campaign to do X, Y, Z. And I just got to tell you, there is no worldwide campaign. It wasn't a worldwide conspiracy that led to so many people going into body bags as they died from COVID-19. That's just hooey. The reality is that, or is it hooey? It's hooey, not
It's
Huey.
hooey, not Huey.
Yeah, I said it wrong. I don't
Huey's
want to
the
play
duck.
all the
Huey's one
Hueys
of the
out there.
ducks.
Don't feel bad. No, it's just hooey. And the reality is that COVID vaccinations are not killing people. We ran through these odds the other day, Hawk.
Yeah.
There is a slight increased risk of blood clotting from the natural occurrence in the population that can occur with some vaccines. It appears to be a little more true with AstraZeneca and J&J. There are therapies for that. We now understand what the etiology of. It's called vaccine-induced thrombotic thrombocytopenia purpura, blah, blah, blah. You can say that better than I can. And what happens is you end up with some small vessel clots, especially can happen in the brain. And the problem is that initially we didn't understand the mechanism. We do now. There is a therapy against that. So it's important to recognize it early. But it happens in a vanishingly small number of cases. And there are very, very few deaths. Now contrast that with the number of deaths from COVID-19, because Hawkeye, that's not just a few.
No, and if you do also understand, look, they are looking at associations, investigating those cases of myocarditis or pericarditis from the vaccine, which is a very, very small number of cases. The issue of the blood clotting that you brought up, very, very small number of cases compared to the number of people with vaccine. If you had 3,000 or 4,000 people who died, wouldn't you expect that, number one, it would be on all the FDA, CDC websites, but also in those mainstream media stories as well? Because even with those handful of cases that we actually know have happened with the blood clotting, there was a big to-do about it and certainly been investigated. So I think it's all a matter of, are you continuing to let your opinions really override what is the true reality? Where are you getting your source of information from? It is very difficult. Some people just do not want to believe that, number one, the pandemic is true, that it does cost lives. We have been very fortunate here in the United States, but also in our community compared to other places. There are orphans being created every day now in India because of what's going on. It is very real. They would do anything, that population, those people would do anything to have the ability to have the vaccines that we have.
You just got to be careful when you get your information from MUNS. What's MUNS? The made-up news network. It's not true. Don't believe MUNS. Believe us right here at the MMU.
I love that. Okay, so we have one more COVID question, 2 blood questions, and we're going to call it a day.
Yeah.
Holly wants to know, is the Delta variant hitting kids harder? I'm worried for my younger kids who can't yet be vaccinated.
What do you think, Hawk?
I don't think we have any evidence of that right now. Again, most of the information that we do have for large scale is really coming out of the UK, but I don't think we have any evidence of that hitting pediatrics harder, having an increase in severity or proportion of severe disease. We know that here in the United States, the proportion of the variant, the Delta variant, is increasing. So I'm sure we'll get some more information about that. But right now, I don't know of any information that says it is creating more severe disease or higher risk of hospitalization for kids.
Lindy wants to know, can you still get blood if you lived in Europe, Germany, in the 80s due to the mad cow disease? She may just be tuning in. I think that's a quick answer.
Chelsea, what do you think? If you had mad cow disease, actually, you probably don't. You're not going to get blood if you actually had mad cow disease, I don't think. Chelsea? You're probably not alive if you had mad cow disease. So
definitely not
I
if
wouldn't
you
worry about
had
that. Yeah, I wouldn't be worried about that one. But now, and we lost you there for a while. We got you back. But I think, as you were saying, now you can give blood. Is that because we can screen for it, or because it's been so long that if you would have had it, you would have had it by now, the mad cow disease?
I think it's the latter. The FDA, I don't know if they gave us their reasoning for changing those rules, but they are our governing body. They dictate the rules that we have to abide when we're collecting blood donations. So they're the ones who said that we can invite those donors back. So we are, and to that specific donor's question, again, I'd encourage her to give our medical team a call just to run through exactly where she lived, how long she lived there, and then we can let her know for sure whether or not she's eligible to come in and donate.
All right, Tracy has the last question, and it is, how long do you have to wait to donate after getting the COVID vaccine?
So,
So you
what do
don't
you
have
think?
to wait at all if you got an mRNA. Sorry,
Go ahead. You're good.
can you guys hear me?
Yep.
Okay. If you got an mRNA vaccine such as Pfizer or Moderna, you do not have a deferral at all. So potentially you could go and get vaccinated today and come in and donate later as long as you're feeling healthy and well. If you received AstraZeneca or an attenuated vaccine, there is a 2-week deferral, although I don't believe that's being widely distributed in the United States, so we shouldn't have to worry about that just yet.
There you go. I want to go back to that question about the 4,000 from the made-up news network. First of all, it's not a real number. It's not true. Second of all, if it was true, the risk of death from COVID-19, should you contract it, is between 0.5 and 1%. If this person's right, and they're not, the risk of death is not 0.5 or 1, it's 0.002%, because I did the math while I was sitting here. 4,000 deaths out of 1.7 billion doses. People, it's not even close. Even when it's the data from the made-up news network is wrong, it's still not even close. Any other questions today, Jill? Are we done?
We have more questions, but we're done. Gene did say, though, I will let Gene comment. He said he saw some people out at theater in the park. He said it was crowded. And he wonders, is that safe?
You know, outdoors is so much safer than indoors, Hawkeye. I feel a lot more confident. It looks like all the data out there says that it's really the indoor events that cause 99% and above of the infections in COVID.
Yeah, I agree. I think, we have said this, outdoors is much better. I think when you do go into these situations where there is a large amount of people, I believe you have to assume that not 100% of the people there are vaccinated. So that has to be the first thing you're factoring into your risk assessment. And then the second thing, is it indoors or outdoors? Really, outdoors is pretty safe. And most people are maintaining some sort of distance during that outdoor time as well.
All right, tomorrow, Dr. Mario Castro, Vice Chair of Clinical and Translational Research here at the Med Center and the health system, is back to update several trials underway for therapies to treat COVID-19 beyond vaccination, but also bring your vaccine questions, because Dr. Castro can help us provide those answers. So final thoughts from today. Katie, let's first turn to you. Thank you again for being on our program and to introducing us to your beautiful family. And final thoughts that you might have from today.
Thank you for having me. I'm just here to spread the word about donating blood. It's free to do. It will save a life or many lives. And I'm just encouraging everyone to go out there, because you never know when you're going to need it or someone you love will need it. And in that event, you won't hesitate to take some. So try and pay it forward as much as you can.
Pay it forward. And that is definitely the real news network right there.
Yeah.
All right. Grant, final thoughts from today.
It's quick, painless. If you've never donated, get out and try it, because, you can help save lives.
All right, less than an hour from door to door, milk and cookies and juice afterwards, and you get to eat the worst Big Mac in your life before you go in, or hamburger in your life, so that you can have follow all the right protocols for the Community Blood Center. Chelsea, thanks again for being on the program. One of these days, you got to be in the studio with us. And final thoughts from today.
Yeah, I would love to be in the studio with you guys someday. It sounds like a lot of fun. Final thoughts, we can't blood shortages cannot be our new normal. It simply can't. So we really encourage donors to come on in. As we try to return back to normal, please don't forget about us. We need blood donations every single day. Actually, in our greater Kansas City area, we need almost 600 every single day in order to sustain our blood supply locally. So don't forget about us as you're returning back to normal and help us get out of this blood shortage.
Yeah, so true. And thanks again for all the great work you and the Community Blood Center do. And as you've pointed out, y'all need to get blood every day because we need that blood every single day. And people like Katie need that blood every day. And it does save lives. Hawkeye, final thoughts.
Yeah, again, as we're seeing, I think, an increase in the proportion of variants, especially the Delta variant. Again, very good article today in the Washington Post. Vaccinated people are protected. Unvaccinated people still have to be very, very concerned. And we've seen that. We've seen it in our hospital. I see it on the floors. Unvaccinated, you are continuing to put you and your family and your loved ones at increased risk of complications, severe disease, and death. Please go get vaccinated in your communities. Please try to get that word out. Continue to endorse vaccination. That is the way that we are going to be able to continue to be opened up economically, but also the way that we are going to continue to be safe and have to avoid trips to the hospital.
So true. Hey, I just wanted to comment again on made-up news versus real news. Here on our program, we really stress the real news thing. We're not going to flapjack. We don't flap our arms. We don't jack with the truth. We try and tell you the truth just as we know it and to stay as current as we possibly can. Hawkeye and I devote a lot of hours to reading about this pandemic and trying to get that information to you in a way that makes sense. Made-up news tends to not make sense. And anytime you have to start thinking about a conspiracy that involves billions of people around the world, you just got to know there's no way that silence could be maintained. So the truth is, believe in the truth and believe in those things that are real. And I want to tell you just how real it was for our teams here at the hospital that took care of so many COVID-19 patients throughout this pandemic and watched them die. This is not made up. This is very, very, very real. Just like Katie's story is real about donating blood and the struggles we all face every day to make sure we can deliver the best possible health care to you. We continue to get questions about the vaccine combined with the CDC lifting masking and distancing guidelines for people who are vaccinated. As we wrap up today, Dr. Hawkinson answers some frequently asked questions, go Hawkeye, go, and I know it's all going to be true, in a video that you can share with folks who want to know more. Until tomorrow, and when we'll see you again, let's hear what Hawkeye has to say.
If you are fully vaccinated, there are less restrictions. You do not need to be masking. You can go to different places and get-togethers, people's houses, and you're able to do those really without those restrictions of the social distancing and the masking. If you are 12 and under, you need to continue to do those things that we have really done for this past year or year and a half, continuing to distance, continuing to mask, do hand hygiene, stay out of those situations where there could be a lot of people there. It is okay to take your kids to the pool. I would still encourage, if not everybody is fully vaccinated, and especially if those children 12 and under, please try to encourage distancing. Baseball games certainly will be less risky because they are played outdoors, so that is always going to reduce your risk of getting COVID-19. If the concerts are outdoors, it's going to be less risky. So it's again judging and trying to determine the amount of people there. You have to assume that not everybody is probably vaccinated. If you can eat outdoors, that will be much safer than eating indoors. If you're grocery shopping or in a store, we do understand that you will probably not be exposed to one person for very long, but there will be other people there who are not masked. So it's just that person's individual comfort level. If you can make certain that everybody is fully vaccinated, under the CDC guidance, they will allow fully vaccinated people to get together without social distancing or masking requirements.